Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. Some of my favorite cases to show off are cases where patients are amazing patients and they follow all the instructions that you give them. They do exactly what you want them to do and they get amazing results in really fast times because of it. So I'd like to share with you a little bit about Claire. So this is Claire, and Claire came to us looking for a nicer smile. And here's a close-up of Claire's teeth. You can see that we have upper front teeth that are tucked backwards. The next two teeth, the lateral incisors, are flared forwards. One of the other things that we wanted to try to solve was how much the upper front teeth were overlapping the lower front teeth. You can't even see the lower front teeth in her bite because of how much they're overlapping. This is a situation that we call a deep bite, and it leads to an extreme wear and attrition of especially the lower front teeth. And so increasing the amount of lower front teeth that you can see helps to preserve and to save those teeth from being worn down in the future. So that was another bite objective that we had. If we look at the side of Claire's teeth, she actually has a large overbite. Now, that large overbite is being hidden by the fact that her two front teeth are so what we call retroclined. They are tipped backwards. But if you can imagine that if all we did was wave a magic wand and make her upper front teeth straight, you would actually see that she has quite a large overbite. And it's because these teeth in the back of her mouth are not in the proper positions. Let me show you that. So I want you to look at the two blue lines on this picture. So we have this blue line on this upper tooth, and that upper tooth, that blue line, should match the blue line on the bottom, right in between these two lower teeth. If you look at the green lines, I have it drawn right on the what we call the cusp tip of this upper tooth, and that tooth should sit right between these two lower teeth so that these two green lines would line up. And same thing, this purple line is the cusp tip of this tooth, and it should sit back here between these two lower teeth. So in other words, we need all these upper teeth to go backwards and we need the lower teeth to go forwards, right? And we have to do it by an entire tooth. These are an entire tooth out of place. That's a lot of change. So how do we typically approach this? Well, when we're using braces, we usually will use a little pre-braces appliance that we call a D2. It's an arm that goes from the upper teeth, so the upper canine tooth to the upper molar. And then there's a button on the lower teeth. And we wear a lower retainer that goes on all of our lower teeth. So what that does, that retainer is like dropping an anchor. It's like putting all those lower teeth together. And then we wear a rubber band that goes from the front of this bar down to a button on this lower teeth. And so what we're doing is we're driving these upper teeth backwards, and we're using the entire lower arch, the entire set of lower teeth as an anchor to pull off of. Now, there's also some effect where the lower teeth go forward. So I've drawn these red arrows to kind of show you lower teeth go forwards, upper teeth go backwards. But this is essentially the setup. Claire did this amazingly well. So we're asking kids to wear some rubber bands, and we're asking them to wear a lower retainer. We're asking them to wear these rubber bands for the better part of the day. So 22 hours is our target. Claire got this accomplished in 3 months, which is incredible. So you can see that in 3 months, now this upper canine tooth, the tip of it is sitting right between the two lower teeth where it belongs. The next tooth is sitting right where it belongs. The next one is sitting right where it belongs. And now, in Claire's case, I went ahead and put braces on the 4 front teeth just to try to get them straighter. Now you can see as they're getting straighter, you're seeing that overbite increase. So we're actually kind of starting to unravel that overbite that Claire actually has. But because of the changes that we've done in the back of her mouth with this D2 or this pre-braces appliance, we're setting up her bite in the back to be exactly where it needs to be so that we can switch over to braces, make everything fit together and make everything look good and have that entire overbite go away. So just to show you that without the drawing on it, this is where she ended up after 3 months. This bite in the back is pretty much perfect where we want it to. And you can see, again, those front teeth are getting aligned. We switched over to our braces. Claire was in braces for 1.5 years, so 18 months. That means her total treatment time was 21 months, so 18 months in braces and 3 months in that D2 or that pre-braces appliance. And just to show you again, all the braces, they're getting the upper front teeth looking good. And this was our final result. So these teeth are in a beautiful position. Look how much more of the lower front teeth that we can see. Remember, when she started, her upper front teeth overlapped her lower front teeth completely, and you couldn't see any of these lower front teeth, leaving them very susceptible to being worn down in the future. So this is a much healthier bite environment. Of course, I love Claire's smile the best. And here she is in kind of a natural smile. And I am just so thrilled for her to have this beautiful smile because she really put in the work and was an amazing patient wearing rubber bands, both in that pre-braces phase and had her wear some rubber bands while we were in the braces as well. Just to show you the difference from the start to the finish. I mean, this is an incredible change to happen in 21 months. And you can also see, of course, that Claire grew up a ton in those 21 months. And so I love seeing these smile transformations. I love seeing kids grow up like this as well. And it just warmed my heart for it to happen to such a great girl who was an amazing patient, and she deserves every bit of this new beautiful smile. So congratulations, Claire. We are so happy for you, and great job with your D2 pre-braces step. Great job with the braces. You have an absolutely amazing result.